So we are going to do another quick talk about cardiac arrhythmias. This is a talk that I gave to a group of people recently at the Lifelong Learning Institute. The purpose of the talk was essentially to talk about what is an arrhythmia, what's a cardiac arrhythmia, and give them the very basics of the kinds of things that we treat in the EP lab as well as cardiologists. A cardiac arrhythmia is essentially an abnormal heart rhythm, but since most people don't know what exactly is a normal heart rhythm, I wanted to go into what exactly and how we define what a normal heart rhythm is. So a normal heart rhythm is usually a regular rhythm between 60 and 100 beats per minute, and we came up with those numbers specifically because that's where most people live and that's where most people have their resting heart rate. Now, that's not to say that it's abnormal when people have heart rates that are lower than that or higher than that, but oftentimes we have to do a little bit more digging to figure out what exactly is going on when people have those kinds of rhythms that are faster or slower than that 60 or 100 beats per minute. So if a normal heart rhythm is somewhere between 60 and 100 beats per minute, it's basically, by definition, an abnormal heart rhythm is something that exceeds those bounds, and more specifically, something that we need to kind of look into and see what exactly is causing fast heart rates or what exactly is causing the slower heart rates. For instance, endurance athletes can have slower heart rhythms at baseline, and that's perfectly fine because when they are able to do their exercise or when they're doing their exercise, they can increase that heart rate appropriately and they don't tend to have issues when they do that. On top of that, heart rhythms that are irregular, essentially heart rhythms that happen not at regular intervals of time, so not at the same interval of time, are called irregular heartbeats. And when a heartbeat is irregular, we need to figure out why and if that's something that's abnormal or something that should be treated. There are some heart rhythms that do cause irregular heart rates, and that's okay because it doesn't cause too many symptoms, and it's also okay sometimes because it's not something that we can aggressively treat in the EP lab. So looking at this image, I wanted to show the people that I was talking to what a normal heartbeat looks like when we're looking at an EKG, what something that's fast looks like, what something that's slow looks like, as well as something that is irregular. So usually the speed on the EKG is somewhere around 25 millimeters per second. So it's moving at 25 millimeters per second, and using that standard definition or that standard speed, we can guess pretty consistently when there's a slow heartbeat or a fast heartbeat or a regular heartbeat. So in order to make it very, very basic for people, when I was talking to them, I wanted to ask them if they understood what the concept of a heartbeat is, because when we're kind of going through this, we need to make sure that our definitions are clear. So the heart itself is something that I wanted to define when I was talking about all of this stuff. So the heart itself is made up of many different kinds of tissues. And when I asked the question what the heart actually is, everyone said correctly that the heart is a muscle. And that's absolutely correct, but it's not complete because there's more to the heart than just the muscle. The heart is a muscle that functions as a pump. On top of that, the heart has valves, which are made out of fibrotic tissue, which helps push blood in one direction. There are multiple different valves. There's tricuspid valve, there's the pulmonary valve, there's the mitral valve, and the aortic valve. And all of those valves work to push blood in one specific direction. Now, we can have issues with those valves. Sometimes the valves don't open properly. Sometimes the valves have a lot of leakiness and they push blood backwards into the chamber that the blood is usually coming from, and that can cause specific issues, usually shortness of breath or swelling in the legs. On top of that, part of the heart is the arteries and the veins that allow the heart to get blood that it needs in order to pump efficiently. So the heart, as everyone said when I asked the question, is a muscle. And as a muscle, it also needs oxygen, it also needs blood and nutrients in order to function normally. So in order to do that, the heart has arteries, it has veins that allow it to get that blood that it needs and to push the blood that has been used back into the circulation so it can be oxygenated by the lungs. And one of the things that I was mentioning to them is when those arteries get blocked, that's typically what we call a heart attack. The heart is not able to get the oxygen that it needs in order to do the function that it needs to do. And when that happens, that can cause really bad symptoms, a lot of chest pain, some shortness of breath, as well as death if that blockage is not fixed in a timely manner. The heart is also made of electrical tissue, and that's where I spend most of my time worrying about, because the electrical tissue allows for the heart to beat in a very systematized and organized fashion. So the electrical tissue as a part of the heart the electrical tissue has many different names depending on where it is. There's a sinoatrial node, which is right here, and that is usually functioning as the pacemaker of the heart and determining what the heart rate is on a day-to-day basis. That then sends electrical signals to the rest of the heart, usually the atrium specifically, and that electrical impulse then goes to the AV node, where that kind of captures and collects a lot of electrical activity and then communicates that to the ventricles, which are the big muscular pumps that pump blood to the rest of the body. And when that electrical impulse goes from the sinoatrial node to the AV node and then to the ventricles, that organizes the heart to create that heartbeat and allows that muscle to squeeze and pump blood as one whole unit. Now, when there are issues with that, when there's usually some delays in that electrical impulse that goes to the muscle, that can cause different issues, something that we call dyssynchrony. Essentially, the different walls of the left ventricle do not pump in a unified fashion, and that can cause the heart to pump inefficiently, and that can cause shortness of breath and other issues. So the heartbeat is all of that combined, and there's a lot going on. This is a pictorial demonstration of what that looks like, just so that I put this in just so that people kind of understood exactly what that looks like. It's not 100% accurate, but it gets the job done. And then this is a picture that just kind of highlights what the electrical side of the heart does when it's pumping blood. Willem Einthoven was a gentleman that studied the electrical side of the heart a lot, and he's the one that developed the first EKG. He was a Dutch physicist, and he used a lot of work based off of Augustus Waller. It was a British physicist, and he's the one that came up with a new way of measuring the electrical activity that's going on in the heart. When he was developing his experiments, he had people place their hands in buckets of salt water or saline, as well as one of their feet. And using this contraption, he was able to magnify and actually come up with essentially rudimentary EKGs of what the heart is actually doing. And before him, it was very difficult, I think, to actually record this electrical activity because, it's a very small electrical current that works in all of us. And he was the one that was able to come up with this specific way of measuring the electrical activity of the heart. And he was the one that got the Nobel Prize for coming up with this specific version of an EKG. So this is how things started, and then over time the technology has improved over the course of time, and now we have EKGs that look much different. And using these kinds of patches and multiple different leads, we're able to get the big EKGs that we have now. And then moving even further, we have smaller devices now that can do EKGs using just an iPhone and a credit card sized device like this that I can carry around in my work bag and use whenever needed if someone has a very fast heart rate. The Apple iWatch works in a very similar fashion. So this slide I wanted to present to everyone just because this is what things look like when we're trying to diagnose fast heart rate in the EKG in the EP lab. And this is essentially what we end up doing is we put catheters through one of the veins in the groin, and we're able to place different electrodes in different parts of the heart, and we can actually measure where the electricity is going and where it's coming from. That helps us diagnose and treat fast heart rates.